exciting to see our agents make the kind of money they're making and provide the kind of value to their clients that they're bringing to the table. So wanted to just open up with this video. This is a surgery center. Surgery centers, just so you'll know, is kind of a new wave of health insurance. One of the answers to the problems in the industry. There's state-of-the-art surgery centers popping up all over the country, and they're a new way of doing things. They don't have the overhead that the traditional hospitals have, and I just want to, I'll show this video to you guys once we get started here. We're going to wait about another 3 or 4 minutes before we get started, but I did want to open up this, and then we'll get into the product. Okay, Josh, we're going to go ahead and get started. Can you hear me okay?
I can hear you.
Okay. All right, guys. Thanks for joining us this morning. We'll try not to keep it too long. Again, my name is Doug Chapman. I'm the CEO of National Group Marketing. We're a national director with Philadelphia American out of Dallas, and we're obviously working with the producers group and with our Florida contact. This product, I've been with it since since it came out, which is in 2011. And just so you'll know, I've been in the individual major medical business for over 30 years, worked with all the carriers, sold millions of dollars worth of individual major medical. And even before the ACA came out, we really saw a serious problem with the traditional major medical policies. Our agents couldn't keep earned accounts. They couldn't keep clients. Obviously, we saw deductibles and co-insurance continue to go up. Premiums go up 20, 30, 40% every year. Couldn't keep clients on the books. And at some point, when you see this year after year after year, at some point you lose all your value. And we lost the value on major medical plans years ago. It was actually overtook the home mortgage payment, which was initially the consumer's largest debt was the home mortgage. It consumed that over 10 years ago. So we realized we had to do something different. Major medical policies are fundamentally flawed. You've got a huge deductible and co-insurance you have to deal with, the client does, which they have to pay first before they ever get a return on investment. So that puts them in an environment where they really don't care what anything costs. They don't know, or do they care? And that's one of the problems in the industry, when the consumer doesn't know or care what anything costs, and when doctors and hospitals don't have to compete for the consumer's business by getting good prices, then you can never fix the problems in the healthcare industry. You've got no regulation. It's kind of the Wild West. Some people charge $2,000 for an MRI. Some people charge $400. Most people don't know that, but you can get the same MRI down the street for $400. So this product came out in 2011, and I actually have it. It's kind of interesting. I've sold major medical for 30 years. I don't have a major medical policy. Wouldn't have one. I have this policy. I've had it for 6 years now, and it's a fantastic coverage. So we're going to go over the benefits with it. We sell a package of benefits, but you have to get it conceptual. You have to philosophically understand it. This is more of it's not so much of a sale as it is of an education. So what our agents doing, once they understand this product and how to articulate it, is we go around and we educate the consumers with knowledge and our experience and knowledge and facts. We use evidence-based selling, and that's what's causing this program to go across the country like a wildfire. It's what's causing our agents to make huge amounts of money and keeping their business on the books. Is what we're doing is designing a package of benefits, stabilizing our consumers' rates, and educating them. It's a lot easier to get a sale when you're not selling something, but just educating a consumer on how to get their healthcare costs under control by providing them with the tools to shop with and the knowledge. So what's happening, I want to show you one video. This is a surgery center out of Oklahoma City, and all of our, certainly Oklahoma City clients that have this policy, use Oklahoma surgery centers and actually make money. None of our clients are out of any money when they go to Oklahoma Surgery Center. And I use them up here in Dallas and all over the country. But I want to play a little video with about a 5-minute video, kind of get your head around this product and how it works, and then we'll get into the benefits of the product.
June Wiskoski is about to undergo a simple procedure to relieve her carpal tunnel syndrome.
A little bit. I think I'm with us, but we'll be asleep.
What makes this routine surgery so unusual is that the total price, which comes to $2,750, is posted online.
We decided we would have price honesty.
Dr. Keith Smith is the anesthesiologist on duty and the co-founder and managing partner here at the Surgery Center of Oklahoma, which is located in Oklahoma City. 3 years ago, Smith and his partner started listing their prices on the Surgery Center's website, a move that would only be considered radical in the healthcare industry.
It makes me mad that a lot of people are bankrupted by our current healthcare system when the costs are many times completely unjustified.
Let's say June Wiskoski had been treated instead at a traditional hospital nearby. Not only would the hospital charge more than double the Surgery Center's price, since she hasn't met her deductible, Wiskoski would have had to pay the lion's share of the bill herself. At the Surgery Center, the bill was so low that her employer simply covered it. She paid nothing.
I like to think of what is done with all of the dollars that are not spent on healthcare here that would have been spent at one of the big hospitals across town.
Wiskoski ended up at the Surgery Center because she and her employer were directly responsible for paying the bill. If an insurance company was covering it, she would have had no compelling reason not to pick the more expensive option. The Surgery Center is part of a growing phenomenon of patients and companies breaking away from the traditional healthcare industry with its distorted incentives and outrageous prices. As Obamacare drives out what's left of markets in medicine, Americans are increasingly turning to providers like the Surgery Center, which show that it is possible to offer high-quality health care at low prices.
It's always been interesting to me that in any other business, tons of research is done into making systems more efficient. But in medicine, somehow or another, that is just completely lost.
Dr. Jason Sigmund regularly performs procedures at both the Surgery Center and at Integris Baptist Medical Center, which is the epitome of a traditional hospital. It's run by Integris Health, which is the largest healthcare provider in Oklahoma, serving over 700,000 patients a year. Sigmund says the Surgery Center is so much more efficient than Integris that it can perform twice as many surgeries there in a single day.
We have pressures to do that because the amount that we get reimbursed for the same case that they do at the hospital is such a fraction that we're really forced to be efficient.
The long-term players in the medical business need to be pushed to a new way of looking at things.
Dr. Stan Baker is chairman of the Ear, Nose, and Throat Department at Integris Hospital. Like Dr. Sigmund, he prefers to do his procedures at the Surgery Center of Oklahoma.
The place is run recognizing the needs of other busy surgeons to devote their attention to the important technical details and not have to worry about a lot of other things. And that's what happens here.
Except for the clerical staff, every employee at the Surgery Center is directly involved in patient care. Human resources and building maintenance, those are the responsibility of the head nurse.
One of the main reasons our prices are so low is that we don't have administrators in $3,000 or $4,000 suits running around and vice presidents at every imaginable level.
At Integris Health, the top 18 administrative employees made on average $413,000 in 2010. The wastefulness of traditional hospitals is reflected in the way they bill for their services. We obtained an itemized bill for a procedure performed at Integris Hospital called a complex sinus surgery, which treats chronically infected sinuses. The surgeon was Dr. Jason Sigmund, who also does the procedure at the Surgery Center of Oklahoma, where the total price is $5,885. The bill from Integris comes to more than $33,000, although the actual bill was even higher than that, since unlike the Surgery Center's price, that doesn't cover the surgeon or anesthesiologist. Integris can get away with charging more than 6 times the Surgery Center's price, because generally its patients don't pay these bills, so there's no real sticker shock. This leads to outrageous markups, such as a $360 charge for a steroid called dexamethasone, which wholesale costs 75 cents, or 3 charges totaling $630 for a painkiller called fentanyl citrate, which costs the hospital $1.50.
They're actually inclined to embrace waste. The more things that are opened up or used at a hospital, the bigger the hospital bill becomes.
Although hospitals rarely collect the full amount printed on the bill, Private insurance companies generally pay around 60% of the total, which is still many times what the surgery center charges. Integris justifies its giant bills on the grounds that it loses a lot of money treating patients that don't have any insurance at all. In a statement, Integris said, "It is our mission to treat every patient who enters our facilities regardless of their ability to pay. And so our charges must be set at a level to allow us to recover costs."
You have turned, Mr. President, the right of every American to have access to decent health care into reality for the first time in American history.
Enter Obamacare, which seeks to extend insurance to all Americans so that traditional hospitals can collect money from all their patients. The truth is that this won't do anything to stop exploding healthcare costs, because when the bill goes to the insurance companies or the government, it inevitably looks like this. Only when patients are responsible does the bill look like this. But companies are beginning to revolt against the system that's eating away at their profit margins.
It just didn't feel right when you got a pacemaker bill come in and the charge for that pacemaker was $100,000. It hasn't always been $100,000.
Jay Kempton runs a healthcare administration firm in Oklahoma City that works with companies that pay their employees' healthcare bills directly out of their revenues.
Now, as we've made it a point to dig under the surface, we're seeing, for instance, that pacemaker may be $9,000. And the rest of that is markup.
He came up with a simple way for his clients to save money. They waive all copays if their employees agree to be treated at the surgery center instead of a traditional hospital.
Shortly after Keith and I started working together, it really kind of dominoed. We've had 4 different facilities in our marketplace have come to us and wanted to be able to have transparent pricing that is for cash paying customers.
Today, the surgery center is doing brisk business, and Smith and his partners are considering expanding.
Now the jig is up, and everyone can see what the prices are here. So it robs individuals who had skimmed off of healthcare dollars. It robs them of their excuse for making sure that patients go to the more expensive places.
Hey guys, I just wanted to share that with you because what's going on across the country is these multi-million-dollar surgery centers are popping up all over the country. Same surgeons that go to the hospitals, they're going over and leasing these surgery centers and doing these surgeries, with huge savings. And our product, when they go to these surgery centers, will pay over 100% of the bill most of the time. However, if you still want to go to traditional hospitals, you're more than welcome to, but you're going to get huge discounts with there as well. So what I want to do is I'm going to go through the benefits of this product and how it compares to your traditional major medical policy. And like they said with the traditional hospitals, the reason they're marking everything up is for people who don't have insurance. Well, the Affordable Care Act is cost shifting the premiums to people who are healthy for the people who are unhealthy. The Affordable Care Act, which is what everybody knows, unless you've got serious health conditions or government subsidies, it's a terrible place to be, frankly. There's no value there. So our product, just like any product, it's got its place. There's no health plan that's all things for all people. If you find one, you won't be able to afford it. So we want to go over and let you know what this is good for, what it's not good for, where it needs to be placed, and where it doesn't need to be placed. I want to start off with commissions. The commissions, generally, you've got a rule of thumb, is 5 to 6 times higher than your traditional major medical. And keep in mind, our clients that are paying the cost of their insurance, as you can see here, where they're paying $1,300, $1,400, $1,500 a month for a family premium, and they've got $5,000 to $6,000, $8,000 worth of deductibles, another $6,000 or $8,000 in co-insurance. Their outlay is $20,000, $30,000 a year before they ever get a return on their investment. Well, the facts are in our industry that 97% of all claims for people under the age of 65 are under $35,000. And so you got people paying that just in premiums and deductibles a year. So we want to address that, and conceptually we want to give them a product. They don't need to be paying tens of thousands of dollars in premiums, deductibles, and co-insurance and before they get a return on investment. What they need is money to pay their medical bills. And they also need money to protect their income if they have medical bills. We're dealing with self-employed, small business owners, employees that work for a living. They don't have government subsidies. They don't have serious health problems. And if they get sick, they need their medical bills paid. They don't need to get sick and then be out another $10,000 before they get their bills paid. So where your traditional major medical, about 95% of all their medical claims will go towards that deductible. With ours, we totally eliminate that deductible. So we're going to do two things. We're going to cut their premiums generally by 50%, put 50% of their premiums back in their checking account. We're going to design a package of benefits to not only pay their medical bills, but to protect their income as well. And then we're going to stabilize their rates. And that's the three things we need to focus on as professionals in the industry. It's our job. We're not, the days of us being order takers with what deductible do you want on a major medical are over. The future health advisor is a consultant. He's a hired gun, if you will, a professional investigator that will bring you a value proposition to get your medical bills paid, stabilize your rates, and protect your income. So we call this a health and income protection package. And as a starter here, just to compare this to your cheapest Blue Cross ACA plan, and by the way, this is last year's. This is almost 2 years old now, so it's much higher than that. We did a quote on a 58, 56 years old. With our product, it is a PPO network. With the Blue Cross is an HMO, the largest network in the country. And by the way, the consumer owns the network and not the insurance company. And we'll get into that in a minute, the value of that. This plan is a $2,500 basically out of pocket or deductible, if you will, in this situation. And they've got a $6,850. We don't have any co-insurance with our plan, and they'll obviously have co-insurance as well. The doctor visit in this plan pays $80 a doctor visit. This is not a copay. It's what it pays, which most of the time is 100% of the bill because, again, the consumer owns the PPO and gets the repricing off the insurance company. And we'll show you how that works in a minute. You've got 40 doctor visit copays, 2 a year with the bronze plan, unlimited with our plan. There's no out-of-pocket, where you have another $71.50 out-of-pocket with the traditional ACA plan. And commissions, from your point of view, an average commission is going to be with a 6-month advance. You can take as earned or advance if you want, up to 9 months. Most folks take a 6-month advance. This case would pay $14.10 to the agent. And then after 6 months, your account is broke out. Every app stands on its own, and you'll get into earned check after that at $235 a month for one. That's one sale. Now, I'll tell you, we got guys selling 4, 5, 6, 8, 10 a week right now, and in other parts of the country. So you can see the commissions, and then obviously the rate stability is no question is much better as well. Patient will not pay a deductible with our plan. We do not have a deductible. And again, you can see the difference in commissions. It's going to be the same amount of work when you go run an appointment, whether you're selling an ACA or our plan. Same amount of work, but a whole different ball game as far as value to your client and value to your career. What's good for your client's good for your career. Who should get this product? Good candidates, healthy individuals. This is a fully underwritten product. Obviously, with the ACA, you can go get sick, go get in a hospital room, and they still have to pay your claims. With us, we do require underwriting. People in COBRA, self-employed, between jobs, out of control premiums, someone who needs a PPO and need a lower deductible, which is everybody. Who should not get this plan? A poor candidate. What this plan is not good for is people needing maternity. Obviously, with the ACA, to be compliant, you have to have unlimited amounts of coverage, and you have to have maternity, no pre-X. So obviously, somebody with a serious pre-X, this is not the plan for. With systemic pre-X and people on costly meds. However, we have added a fully insured drug card that actually takes pre-existing conditions. We can talk about a little later in the presentation. Health Choice Select is the plan we want to go over here. We call it a health and income protection plan. Why do we do that? And you'll sell a package of at least 3 policies. We do that for 2 reasons. One reason is we want 3 policies. The health plan is going to pay about 5 times better than your traditional ACA. We always add an accident policy to the health plan because accidents are 68% of claims nationwide. That's the most frequent claim. So we want to create a double indemnity for 68% of the claims, and that also doubles your commission the accident policy. It stacks on top of it, pays in addition to. And then we put a critical illness policy, a lump sum, anywhere from generally $20,000 to $50,000 on the husband and wife, certainly the breadwinner, every time, because that gives him cash money. If he does have a heart attack, stroke, or cancer, he's not going to stress out on losing a home, and he'll have at least 6 months, maybe a year's income to fall back on while he's focusing on getting healthy. And by the way, the critical illness will pay 3 times your commission. So your blended commission is outstanding, and then the rate stability is crazy. Your health goes up about 3% a year. Accident never goes up, and the critical illness maybe goes up every 5 years, a couple of bucks. So very rate stable, which is what our clients need. Health premiums are the number one financial problem in the country for the small business owner and American family, is out of control health premiums. So we can address that and stabilize that, and we got a product that will do that. As you can see, the number one reason for bankruptcies and foreclosures are medical bills. And the interesting thing is 78% of those folks had a major medical policy in place and still went broke. So that tells us we're not designing or lotting our clients' premiums properly. A major medical policy at the end of the day is really nothing more than an income protection plan for doctors and hospitals. We're dealing with a self-employed business owner, employee, and they're flat on their back for 6 months going through a lot of medical bills. They need their income protected as well. Who cares if we pay their medical bills? They're still going to go broke. So we got to design the package where it'll protect their income as well. One of the key features to our program that makes it so unique is it uses multi-plan PHCS network, which is what most of the major medical policies use. And for those of you who've been selling, I know, a major medical for years, like I have, you know that if the client doesn't stay in network with Blue Cross or whoever, they go outside of the PPO network, they're severely, severely penalized by doubling or tripling their deductible and coinsurance. That's because the Blue Crosses of the world, the major meds, get huge repricing, similar to the video just showed you in the background. They don't share that with the consumer. If the consumer doesn't let the major medical policy get that huge discount, they're going to penalize the consumer. They're getting it one way or the other. With our program, the PHCS network, the consumer owns and not the insurance company. And this is the heart of the sale. This is the value of the program, in my opinion. The most important part you got to get over to your consumer. We don't care where you go with this plan. You can go anywhere you want, but if you stay in network, you will get your bills repriced from retail to wholesale instantly before anybody has to worry about paying a claim. As you can see, your average repricing is 40 to 60%. And this is at the traditional hospitals, not the surgery centers, which is even greater. So the key to the plan is educating the consumer the value of shopping just like they do everything else every day of their life. Nobody questions the doctor or hospital, and they need to start doing that if they're going to get their healthcare costs under control. The plan is a $5 million lifetime maximum per policy, and here's how it works. There's 3 price points. You have an aggregate amount, which is considered a bucket of money. Your client can choose $100,000, $250,000, or $1 million, and this bucket of money is per person in the family. And it is a calendar year bucket of money, okay? And if you go to the hospital, there's another price point. You can, on your first day in the hospital, there's no deductible, but you do have an option to lower your premiums by going 80, 50, or 20% benefit on the first day hospital confinement only. And keep in mind, let's say you do a 50%, that means the first day in the hospital, your daily hospital benefit will reduce by 50%. And that gives you a co-payment of $2,500 or whatever the case may be. We'll look at it in a minute. And the rest of the days in the hospital, in or out, are full benefits. So let's just look at a 50% plan. This is our most popular plan. And you have 1, 2, or 3 units, which is A, B, or C, bronze, gold, silver, whatever you want to call it. We're going to talk about the 2-unit plan here, which is our most popular plan, and 50% is the most popular reduction of benefits. What that means is on 2 units, as you can see here, This is a defined benefit plan, guys. It defines what it pays, and very different than your traditional major medical. There's no deductible. So philosophically, if you can put half of their premiums back in their checking account day one, and let's say they're paying $20,000 a year in premiums, and you can put $10,000 of it back in their bank day one, get them out of their $5,000 deductible and their $6,000-7,000 in coinsurance, you've got a $20,000 a year head start before you ever go to the doctor or hospital. But then when you go to the hospital or doctor, there's not going to be a deductible or copayment. So this plan pays $3,000 a day every day you're in the hospital for sickness, just for your hospital room and board. Now, if you go in for an accident or injury, it's $6,000 a day. This is just for your hospital room and board. So I want to stop right there and educate the consumer, because even us as agents have no idea what a hospital bill costs, most of us. I didn't for 30 years. I do now. The hospital in Dallas, Texas is going to run between $1,500 a day and $2,800 a day at the high end. So keep in mind, if I'm in the hospital with 2 units, it pays $3,000 a day. Well, that means with my 50% plan that it will reduce by 50%. So I have a $1,500 copay. If it's an accident injury, it's $3,000. But again, if my bill is repriced to $1,500, and it will be, let's say your bill is $2,800 a day on the high end, the average repricing when you're in network in the hospitals in the Dallas-Fort Worth area is 49%. So that means the 2,800 reprices to 1,400. So even though the 50% plan, I still wouldn't be out because I've got enough money to cover that after my reduction the first day. And obviously, every day after that is back to $3,000 a day or $6,000 a day for injury. Okay. So again, these are price points. You can do 100%, not have any reduction, 80%, 15, or 20%, and the price adjusts each benefit you choose. And you can see the premiums here as well. We put a little premium on this 40-year-old male with 2 units, $250,000, which is our top selling benefit. First day ICU again pays as well. And when you get in here, hospital confinement, 2 units, $1,500. 1 unit is $1,500 and $3,000. 2 units, the most popular is $3,000 or $6,000. And of course, 3 units, the Cadillac plan is $4,500 a day or $6,000 a day. We sell a lot of this. We're still saving people tons of money. Hospital ICU. You get 20 days a year in ICU, and this pays $4,500 a day for 2 units or $6,000 a day if you're in ICU for injury. Hospital mental and nervous substance abuse is $400 a day. Skilled rehab for $1,500 a day. Again, this stacks on top of the daily benefits. Outpatient chemotherapy, $1,500 a day. Outpatient surgery center, there's no deductible. Again, with your traditional major medical, 95% of your claims are going to have to be paid before you get a return on your investment. With this, there is no deductible. So if I go to a hospital surgery center, it's going to pay $3,000 and I'm put under, and I just had a surgery. I'll show you my claim here in a minute. $3,000 just for my room rate, which will be repriced about $1,500. So I'm actually getting an overpayment, which I would actually receive that money. So again, all these benefits stack in your brochure. This is your surgery. You have a surgery schedule. We're going to focus on 2 units because, again, the 2-unit plan is what we're talking about. And the surgery schedule is equal to Medicare allowable. It's called Resource-Based Relative Value Scale. That is, and what 1 unit pays what Medicare allowable pays. And as you can see here, your average surgeon is going to charge about 20% over what Medicare allowable pays. So if I've got a 2-unit plan, that means I'm going to get 2 times what Medicare allowable pays. 3-unit plan is 3 times. So I'm going to get plenty of money for my surgeons and assistant surgeons and so forth. This is your doctor visit for 2 units. When he comes by with his clipboard in the hospital, he's going to charge you about $150 to come by and visit with you. That's going to be repriced about $75 if you're in network. As you can see, $100 is plenty to cover that as well. So generally with 2 units, guys, it's going to pay about 60% of your medical bills in or out of the hospital. If you're in network, you're going to average at least 40% repricing. So 60 and 40 is 100%. That's why that's our most popular plan. And obviously all these benefits stack. Now, as you go over here to your outpatient, again, no deductible. These are not copays. So 2 units is going to pay $80 every time you go to the doctor. Now, your average doctor visit, just so you'll know, is about $120 to $130. But your average repricing is it's 47% in Dallas. It gets up to 50% most places. But let's just say it's 40. Let's say 50% to keep it simple. Let's say your doctor visit is $150 and it's repriced by 50%. That reprices down to about $75. That's what the doctor has to charge your client instantly. Once he shows him the card and he knows he's a PPO, he has to give your client the contract rate. He's going to get $80. So he's getting, if it's $70, they're going to electronically pay the $70 to the qualified physician, and the client's actually getting a $10 check in the mail over payment. Now, if this was a Blue Cross plan with a $40 copay, Blue Cross would get the client thinks we're paying 40 out of 150. Actually, the bill's getting repriced to about 70, and the client's paying 40 out of the 70, and Blue Cross pays the other 30. The client's paying an extra $1,000 a month or whatever. So again, plenty of money for doctor visits. Generally, your client won't be out any money at all, or maybe $6 or whatever the case may be, $5 or $6 copay. You get a bucket of money, again, $250,000 with the 2-unit plan, inpatient, hospitalization, surgeries. Outpatient, you have a $4,000 bucket of money, or $6,000, depending on your units, for every member of the family. And every January, you get a brand new bucket of money. Okay? And you're allowed 20 doctor visits a year. And then obviously labs, x-rays. As you can see here, mammograms are $125. They're generally about $250, repriced to about $100, $125. So you got plenty of money for that. Colonoscopies and all other preventive services, $125 for wellness. And again, the $4,000 bucket of money is for each member of the family and resets every January. So does the $250,000 every January. You get a brand new $250,000. MRIs, I had one a while back. 2 units pays $350. This is where you really need to educate the consumer, because consumers think they're $1,800, $2,000 for MRI, and they're right. They sticker for that. The largest repricing, as you can see, is in this category at 60 to 80%. So if they go, all they got to do is call Caris, and they'll give them 10 MRIs to go get. And we'll talk about Caris in a minute. Make sure they're in network, and their MRI is going to be about $400, $450. It'll be about $50 or maybe $100, worst case scenario, with 2 units. They'll make money with 3 units. But obviously with a major medical, they're going to have to pay all of it, because that's going to go towards their deductible, as well as the x-rays and the labs and everything else. So again, these are not copays. These are what it pays after repricing. Is going to be plenty of money in most cases. $40,000 a year as well. Emergency room, guys, is not really strong. It's $150 for 2 units. We do have an increased emergency room rider you can add to it. They don't want folks going to the emergency room unless it's an accident or emergency. A lot of folks use emergency room as a doctor office. They want to deter them from that. Obviously, if they're admitted to the hospital, the plan's going to kick in and pay plenty. But just to go and leave, it pays $150 for the facility fees and another $150 for professional, be about $300. Again, we have an emergency room rider you can add and beef that up. We're going to throw another $10,000 on top of this with our accident policy coming up here in the next slide or two. Urgent care benefits, emergency rooms all covered. You've got a ground and air ambulance. Again, nothing special here. $500 for ground, $1,500 for ambulance. Again, we're going to put another $10,000 on here by stacking the accident policy on top of it. It's got $10,000 for ground and air ambulance. Generic prescriptions, guys. This is the only part of the plan that's an actually reimbursement. You get a discount drug card. We'll show you, and you type it in, and all the pharmacies will come up and give you your options. You tell you where to go get the best discount, and then obviously you do pay for the prescription. And every 3, 4, 5 months, you can fax in your prescriptions. They'll reimburse you. If you get a $5 generic at Walmart, you're getting $15 back. If it's $50, you're out $20 on a brand name or whatever the case may be. It looks like this, the prescription drug card, you get a discount. And what you do is you type in your prescription on your website, and all the pharmacies will pop up, and it's literally this much difference between the pharmacies. I was getting my cholesterol meds at actually Target, and they were about $75, and the same med was $9 at Walmart. So obviously I go to Walmart for that med. Now another med may be completely backwards, okay, completely opposite. You can see huge discounts and the reimbursement too. But again, you have to keep that in perspective. If you look at this, it's a reimbursement. It's not a great benefit. But again, if I'm putting $500 a month in your checking account day one, I had a guy tell me I got a $35 copay with Blue Cross. That's a lot better than this, Doug. And I was putting $500 a month in his checking account, and he had a $700 deductible in front of his RX card, and then a $35 copay, and he was paying $150 a month for his drug card with Blue Cross. So in actuality, he was paying $2,500 a year to Blue Cross in premiums and deductibles before he could give him a $35 copay. So if I'm putting $500 a month in your checking account day one and paying you with no deductible, it's a lot better value. And then we do have a true drug card that's a fully insured. We're actually going to train on next week that takes pre-existing conditions. $10 copay generic, $35 brand name. It's huge. Make sure you're on that call next week. Teladoc, guys, this is a value-added option at no cost to the client. And on our website, we've got videos on all of these. And also, we've got agent testimonials on the National Marketing website. You want to go check those agent testimonials, kind of money they're making and what they're doing for their clients. Very powerful. Teladoc's got a video on our website as well. But Teladoc, every client gets it. It takes 5 to 10 minutes to set up a profile when you get your card. And then anytime you get sick, instead of taking half a day off, you can pick the phone up, talk to the doctor in 30 seconds. He'll call you in a prescription 9 times out of 10. You don't ever have to take half a day off and don't have to go to the doctor, and you don't cost you a dime. So that's a huge benefit. Now, here's how the plan works, guys. When you go to the hospital, once the client understands he can get all of his medical bills repriced by these huge amounts, because every doctor or hospital has a cash price. Most clients don't know that. You don't have to negotiate it. All you have to do is stay in network, and it's already pre-negotiated. So your client goes to the hospital or doctor. It's called PALIC, Philadelphia American Life Insurance Company. The doctor will verify coverage on the card. Charges will be forwarded to the National Claims Clearinghouse. The National Clearinghouse will electronically forward information to ECOM, who will reprice the claim. ECOM will reprice the claim and send it electronically to Philadelphia American's claim system. Now, PPO discount will be shown on the EOB report that is sent along with the claim payment. Most of the time, guys, the hospital or doctor will file the claim, certainly if you're in network. Now, if you're in a car wreck or something, like I actually was, and your car insurance is paying for your medical bills or the guy that hit you, then you can file those claims yourself and pocket that money, because it does pay in addition to other insurance. That's very important to understand. Now, if the HSP policy pays more than the bill charges less the discount, the PPO discount, we will send the provider the PPO discount amount, and the policyholder receives the difference. I've had 3 surgeries in the last 6 years, and I've made money on every surgery I've ever had. I wasn't out a dime. I actually pocketed thousands of dollars in overpayments. I'll show you some of my claims in a minute. Here's a claim of one of my clients in East Texas. He cut 2 fingers off, and one of his bills was, let me back up here, $1,785. This is Mother Frances Hospital in Tyler. And as you can see, since it was a network, the bill was repriced from $1,785 to $896. That's almost a 50% repricing. So all we have to deal with is the $896. That's all we have to that's all we have to focus on. Here's another same guy. This $10,000 bill from Mother Frances was repriced to $4,300. So not only did this guy have his bills paid, he had an accident policy paid on top of it. He pocketed about $5,000 after everything was paid off. 56% discount. So very powerful And all we're doing is transferring the PPO repricing to the client away from the carrier, and then giving the client the money to pay bills, which is what all the client needs is money to pay medical bills and stable rates and income protection. That's what we've got to provide for our clients. Here's another different look. This guy had 3 days in hospital stay. This is the 3-unit plan, prostate cancer. As you can see here, when his bill totaled up to $24,848, he had the 3-unit plan, which came up to $22,000. Now his first day, 50%, which was his first day, was reduced by 50%. So they took the $2250, which is half of the $4,500, and removed it from the check, similar to a car insurance. Well, I just removed the deductible from the check. So in this scenario, he's out $4,700, but that was before the bill got repriced. As you can see, his actual bill was repriced to $14,900 because he was in network. So now he's got a $22,000 check minus his $2250 copay, if you will, a reduction. He's getting a check for $5,100 after they reduced his deductible, or his copay. Now he also had a $50,000 critical illness policy, which 95% of all of our clients have a critical illness policy. This is a lump sum, cuts him a check. Since he was diagnosed with cancer, he actually got $55,000 sent to his house, overpayment of $5,000, and his CI policy paid him a lump sum of $50,000. Now let's just stop right here. His premiums are less than half what he was paying for a major medical. He's got accident, critical illness, and health insurance. A major medical policy, if he'd had a major medical, the $24,800, he would have had to pay at least $5,000 deductible and another $6,000 or $8,000 in co-insurance. He would have been out anywhere from $9,000 to $11,000 in the same scenario with the major medical, because Blue Cross would have repriced this to here. He would have had to pay his deductible and his co-insurance out of this balance here. And he would have been left out, and he's paying twice as much for that. And he's getting a 30-40% rate increase every year because he's in a block of business with sick people that don't have any pre-existing clause. So he's getting to eat all their pre-existing conditions as well. So again, 2 units, he still made $50,000 with 2 units. And you can see the same scenario. So the critical illness policy is a separate policy we stack on top of the health plan. Sorry, it's jumping around on me. I'm not doing that. We keep in mind, we call it health and income protection. We want to add at least the primary breadwinner. We focus on at least 6 months of his income, and we'll put a lump sum critical illness policy with Philadelphia American, which pays you 3 times the commission of your health. But more importantly, it's going to slap a $30,000, $40,000, $50,000 lump sum payment. And 85% of us are going to deal with the big 3 at some point. Most of us after the age of 65. Well, this policy they can keep after the age of 65. They can never get it cheaper than they can today, and they won't be able to afford it if they get older. But once they get it, they got it, and it won't go up on them. So this they'll have this till the cows come, till they're no longer with us, frankly. And you'll get your renewals for years and years. So always put another 30 to 50 grand on top of their plan in critical illness, lump sum. And it is in 2 lumps. It pays $50,000 up to $50,000 if they have a heart attack, stroke, or cancer. And then they have another bucket of money, as you can see, if they have cancer or if they have a heart attack, they get another $50,000. So it's paid in 2 categories, so they could actually get paid twice. Not a specified benefit, but it's a lump sum. Upon diagnosis, you get a check sent to your house. It's that simple. So the accident policy, another separate policy. Accidents, are the majority of claims. We want to create a double indemnity on accidents. We always sell 2 units because it's twice the benefit, but not twice the premium, so it's a better value. As you can see, it has a $100,000 accidental death policy in there. It also has a $10,000 ground and air ambulance policy. This pays the client. It also pays $300 a day. Every day he's in the hospital for lost income. And up to $20,000 for dismemberment. And then it pays, let me back up here. It pays it pays 100% up to $4,000 to the client, no deductible or co-insurance per incident. So the client, anytime he has an accident or injury for any member of the family, is going to get 100% of their medical bills reimbursed up to $4,000 per occurrence, plus the other member benefits that are in here. We do have dental and vision, great dental plan. So generally speaking, we'll put a package. 95% will have health, accident, critical illness, and probably 80% have the dental and vision as well. And the total package, guys, gives you some great benefits for a long time, benefits to your client. I want to show you one thing before we go. I know it's getting late, but I want to show you my claim. I had 4 months ago, had a major serious snow skin accident and had to get shoulder surgery, total reconstructive surgery. So this is a sample of my claim. I went to Star Medical, which is similar to Oklahoma Surgery Centers here in Dallas, state-of-the-art facility. Now, as you can see here, my bill, they are PPO network. My bill was $11,393. Well, look at my repricing. The discount, because I was in network and I own the network, is $7,000. Guys, that's a 70% discount here in Dallas, Texas. That repriced this bill to $4,144. This is all I owe. Well, Philadelphia American, as you can see, my check was $10,900 is what it paid for that outpatient surgery for my daily room benefit, my surgeon's fees. So the $10,900, all they owed was $41,000. So they sent a check to Star Medical for the $4,144. And as you can see, they sent me a check for $6,771, which is the balance of what that's called an excess indemnity. Now that is not, I also got another $4,000 for my accident policy. So I made over $10,000 in my account, had no deductible to deal with, no co-insurance to deal with, had a state-of-the-art facility, and I actually made more than that with my MRIs and all that other stuff. So, had I had a major medical, I'd been out about $9,000 out of the $4,400 that was actually repriced it. So very powerful, exciting product. We're excited to bring it to the state of Florida and looking forward to working with you guys. Josh, are you on the call? Do you want to open it up for questions? Do anybody has any questions?
Can you hear me, Doug?
Yes, uh-huh.
Can you touch base on your 3 main marketing approaches, or at least the top one? You're out hitting groups. I know you've in your marketing strategies for this product, please.
Well, our agents are obviously we have lead programs, telemarketing programs. What's happening in the industry, guys? Our agents are making more money than they've ever made in their lives, and they're writing business hand over fist. It's because the industry is in so much turmoil. Businesses are pissed off. They've had it with these huge rate increases and not getting any return on their investments. And all we have to do, and we walk and we go out and talk to business owners every day. We lead our guys that are doing the ACA, which starts actually in I guess a few weeks or a month or so. They're just giving this as an option. What they do is they'll quote on it. They do an ACA quote.
Good. How are you?
Good.
Andrea?
Andrea, yes.
She here? Yeah.
You guys, we get a lot of
kind of late, guy.
Can you mute that, please?
Any questions, guys? We're getting a lot of background noise.
We're not going to come.
No, we are.
She went to Starbucks. She'll be back in a minute.
I'll put you in touch with the group here on an individual basis, Doug, if we want to. Somebody's over talking.
Perfect.
Sorry, guys.
Literally just ready to Starbucks.
Okay.
Hey, guys. Yeah, we're gonna. If you guys need star 6, you mute yourself out unless you have a question, if you would. But we're going to open for questions if anybody wants to unmute yourself and ask a question. One of the questions we had, Keith said, is how do we market? Well, any business you go by, we can show them a way to save up to 50% or more on their premiums, and while stabilizing the rates and improving their benefits. We're actually giving them a better package of benefits. Guys, we're saving families tens of thousands of dollars a year. If you'll go to the Nash Group Marketing website, which we had pulled up earlier, which is right here, we've got some agent testimonials. And this right here, the Caris Group videos on our Teladoc. Once you contract and get your writing number, this will be our back office and the agent field. We've got our top trainers, what you sell online, we have guys making, huge amounts of income selling online. The top producers we have in our industry with this product show you how they sell it on the phone, how you sell it face to face, how we have marketing strategies, everything. Obviously, agent testimonies, click on that and listen to the agents that are selling it, what it's done for their career and their clients and how excited they are. This is the future of healthcare, and we're in our 7th year. It is sweeping the nation. It's because it works. Agents couldn't be more excited. Their clients are happy. We found the holy grail, if you will, at least an answer to this serious problem, this crisis in America of out-of-control health premiums. And you fix it by starting with educating the consumer to shop just like they do everything else. I'll give you a perfect example. The CARES group is one of your benefits that your clients will get. Now, what the CARES group does is they will, your client, anytime they have a surgery, all they have to do is call the CARES group. The CARES group will give them 5 locations to get their surgery in their area. They will give them a bundle price. They'll drill it down and get them the cash price on the best price, and they can choose wherever they want to go, but they know exactly what it's going to cost them and what their plan pays before they ever go. And now also, if you have an MRI, this is a perfect example. My manager in Oklahoma said, Doug, a client called me the other day from the doctor's office. That client had an MRI, and the doctor told him to go get an MRI. Well, she called Kent, went in there, gave him the card. The card, she had 3 units, paid $525, and they wanted $1,000 for the MRI. And they wanted a $475 copay. She said, Kent, what do I do? And Kent said, is your doctor going to pay for your MRI? She said, no. Then you need to tell your doctor where to go. See, the doctor sends you where he wants you to go because he gets a referral fee, $500-600. It's a commission because he just sold an MRI. And then Kent said, don't go where your doctor tells you to go. He owns a facility. He's getting a commission. Call CARES. She called CARES. CARES gave her 10 locations, emailed her 10 places to get an MRI. She picked one out. They set it up for her, told her what to bring, put her on a VIP list. The MRI was $400, and they paid the $400 and sent her a check for $125. So what the CARES group does, and the video is right here, guys, all of our products, these are all built into your package at no cost. The Teladoc, the Pram drug card is our drug card, and the CARES is in here as well. So all the videos are here. But the CARES is a free benefit. They'll tell you where to go to get a surgery. They'll make sure you're in network. They'll tell you where to go get MRI, and they'll walk you through the maze, if you will. So tools to shop with, teaching your client to shop. And the doctor doesn't work for your client. The client doesn't work for the doctor. The doctor works for the client. And so give them the knowledge. And the surgery centers popping up all over the country, like we saw in Oklahoma. That's all over in Florida right now. They're all over the place. We'll get you those located. And most of them are PPO network providers. The same surgeons that are working at the big hospitals. When you understand how a hospital works, if they've got 1,000 employees, you've got 600, 700 of those employees have nothing to do with treating a patient. They're an overhead. They're expenses, cost of collections, and so forth. Well, that same surgeon can lease a state-of-the-art surgery center, and 80% of surgeries are done same day. Go over, do the surgery, and leave like you did with me, and you're looking at the huge discounts and the savings that we get. So it's just it's educating your consumer, giving them the knowledge, and then giving them the money to pay their medical bills. And it's exciting, guys, to bring a value proposition to your clients and protecting their income, so forth. We do list bills. We have a guaranteed issue, 1 unit, just so you know. Let me show you a brochure here. 1 unit is guaranteed issue, and we also have, when you do list bills, we've got guys going out doing list bills. Like if you have a 10 or 15-man group, if 8 of them sign up, it's guaranteed issue, no underwriting. For wife, husband, for the dependents and kids too. So just think, we've got guys making, $200,000-300,000 a year, selling 2, 3, 4 families a week. So you can actually go into a 10 or 20-man group and write the whole group in one presentation and get guaranteed issue with no health questions. We're going to train on that in the next few weeks. I don't want to get ahead of myself. It's a fully underwritten plan, but you can sell it in groups and get it guaranteed issue. But run leads, anybody that's a candidate is any self-employed, any business owner, any employee, anybody that does have serious health conditions. And but the Affordable Care Act has its place, guys, and that's for people with government subsidies or serious health conditions. Other than that, we've got a much better option for those folks. Any questions, guys? One unit, we do have one unit, Keith. You and I talked about this, where if you do one unit, let's say you sell a family and they get 2 units and the dad is insulin dependent diabetic, he would be a decline. He would make it through underwriting. However, if you put the rest of the family on 2 units that can qualify, you can put the dad on 1 unit, rate him up, and he can get guaranteed issue. So the 1 unit plan can be sold guaranteed issue as long as somebody else in the family gets on the plan as well. That way you're not, just doing adverse selection. We'll talk about.
Doug's really good at the best of this, and I see Don, Jamel, Joan, Lisa, all you guys. If there's any questions, I mean, this is the man that knows the product beyond anybody I know, even the company people. So if anybody's got any questions, please hit a *6 to come off, or they're all off now, right?
Yeah, we've got videos, guys. Once you get your writing number and you go to the National Group Market website, we'll give you a passcode, and in the back office, we have our top sales guys. On each one of them have their strengths. Some of them are face-to-face. Some of them are online. They will actually show you. Here's one of them right here. We won't get into it. They'll actually show you this guy makes about $500,000 a year selling this product, one family at a time. And here's his presentation right here. It's in our back office. And so getting comfortable with it, it's different. You're going to have to unlearn a few things. It's not your traditional major medical. But you know what, guys? If we're going to change the industry, we got to change what we're doing. It's the old adage, if you insanity is the definition of expecting different results and not changing what you're doing. So this is totally different, your traditional major medical, and we can provide rate stability. We can provide money to pay your medical bills. We can provide income, money to protect your income so you don't lose your house, and we can protect you. And it's exciting to be able to bring a value to your consumers. And that's what we're supposed to do. That's our job. And unfortunately, the industry's made it very difficult for us to do our job. But we found a way to do it, and it's with this exciting product. So
we have another webinar Thursday to go on further, right, Doug?
Yes. Anybody that contracts, we'll be on we'll go in depth. We'll do quotes. We'll show you how to package it. We'll get into the benefits and show you how to simplify it. A lot to talk about, but it can be simplified and make it real easy for your clients to understand. And but everybody gets contracted. We're going to do another training, and we'll show you how to do rates and quotes and so forth.
Yeah, you'll be getting a link to be contracted. Yeah, you'll be getting a link to contract, Don. I need an email address for you, I noticed. Tax advantages for business owners on this is I see some of the questions that are popping up. Doug, please.
Yeah, there are. You can get some tax advantages. That's a different. There can be some tax advantages to business owners. We've got some other plans that we tie into a Section 125 with it. You can do a 125 with it, some other things. But when you go into your group, guys, it's not traditional group. When I go in to talk to a 20-man group, I sold one for an agent yesterday. It was a 15-man group. They didn't have any benefits, couldn't afford it. I went in, and here's what I said. I said, guys, you got 2 choices. You can go with the true group insurance, and it's got advantages and disadvantages. The advantages to group insurance is everybody gets approved. The problem is nobody can afford it because everybody gets approved. You're going to load the healthy people to pay for the sick people, just like we're doing with the ACA. You're not going to have any individuality. Everybody's going to have to take the same thing. You're going to have 60-year-old people paying for maternity. You're not going to have any portability, but everybody gets approved. Or you can go with an individual policy. I can come in with an individual policy, and your rates are half the cost of group. Why are they half the cost? Because they don't take everybody. They only take healthy people. You have to go through underwriting, but they're half the premium. Another advantage to individual policies is they're portable. You can take them with you when you leave. Another advantage is they're individual. You can design each policy based on the client's, the employee's needs, where they're not all taking the same thing. You can design it based on that employee, deductible, benefits, so forth, and they're half the cost. And with our plan, it's a fully underwritten policy that can get guaranteed issue with no rate ups or lows. So I can come in there with this policy that's fully underwritten, design it, get the individual rates, but they're half the cost. Now the commissions are 5 times higher for you because it's individual commissions, but it's portable, and then it's called an individualized group or list bill. And I can get it guaranteed issue with no rate ups or lows, even for the sick people. You can put the wife, she can be 400 pounds and diabetic. She's not even a rate up. But I can't write her individually with this policy. She's a decline. So, and you can keep your individual commission. So, guys, I'm telling you, this thing is special. And we've been doing it for 7 years. I have it. Had it for years. And for the guys that latch a hold of this, it's changing lives and changing careers. Look at the testimonials. And we've got leads, we've got advances, we've got training, and we've got the best agents in the country that'll just share. We're big on teamwork. Keith knows this. We'll share our top guys' presentations with you guys. We want to get you up and running as fast as possible. And the commissions are huge. Your blended commissions at the agent level are 30% and sometimes up from there, because you're selling a health and income, or you're selling health, accident, and critical illness with one premium. Now, what happens is they're going to keep it for years and years. You're not going to have to rewrite them every year or two like a major medical, because they don't have rate increase problems. They will lose their health at 65, but they will keep their accident and critical illness. That bank draft has one bank draft with 3 numbers on it. When they get 65, you'll write them a med sup, but they're going to keep that accident and critical illness. Who wouldn't? That's when you're going to need it the most. Obviously, we know our chances of having a heart attack, stroke, or cancer is 85% after the age of 65 are going to go through the roof. So you want to keep that critical illness and piggyback that to your med sup. You won't be able to afford it later, but you can afford it now because price, because you're younger. And accidents, I thought it was young people. It's old. The people over 65 are the most likely to have an accident. Yes, Chief.
No, it's just a great point that New Era has a very strongly priced med sup in Florida also now. So just FYI.
Well, what's exciting to us, guys, I was in the major medical world. I had agents that were rewriting the same clients every 6 months to 12 months to a year and a half, every year, rewriting the same clients. You can't grow your company if you're rewriting the same clients over and over. And you're not bringing value to your clients if you have to go out and rewrite them every year or so. It's exciting to us to see guys have policy owners on the books 5, 6 years, 7 years, and they're writing 400 or 500 new clients every year, and they're getting 3,000 or 4,000 blocks of business, 3,000 or 4,000 clients that they're still getting renewals on. When the renewals are higher than your first year commissions on major med anyway. So
we're also working out for Doug to come to Florida on agencies and some individual agents as he's traveling down that way. So if I know Mr. DeMarco is on board here, and I know you have a decent sized agency, please keep that in mind for us.
Yeah, so just do what our guys that are doing it do, and we'll share the presentations with you once you're contracted. We'll do live webinars. We'll show you how to do list bills. We're all one big team, and it's exciting to finally deal with this serious problem in the healthcare crisis in this country and having an answer. We're problem solvers, guys. We got the problem solver here.
We also have a recording of we're going to put out there to people that want it, that came in late for this whole webinar. And we have one Thursday. You're going to be getting a link on that in the next few minutes, hopefully, for the Thursday training on moving forward once you get your agent number. Yeah.
Exciting product, guys. Here to help you. Any questions, give us a call, and we'll look forward to seeing you guys Thursday when we get into doing quotes and scenario selling and so forth.
Thanks for taking care of us, Doug.
Okay. Have a good weekend.
Bye.
Bye-bye.